Since 1924, the American Heart Association has been fighting heart disease and stroke and helping families and communities thrive. With 32 million volunteers and supporters, we've contributed $6.1 billion to life-saving research. With your help, we have saved lives. But much work remains, especially among communities with a history of facing persistent health challenges. We believe everyone, everywhere, no matter who they are, no matter where they live, work, or play, deserves to live their healthiest life. Our community initiatives are making a difference. We are removing long-standing barriers that keep all people from living longer, healthier lives, recognizing that there is significant need in communities that have been overlooked. We are advocating for leaders to work together to address the health challenges facing our communities. Almost 50% of Americans have high blood pressure. This silent killer is often undetected and untreated. Communities that have historically lacked access to consistent, affordable health resources are impacted at greater rates. We meet people where they are to help improve blood pressure care, self-monitoring, and we connect community organizations with the right tools and resources to join these efforts. 1 in every 10 Americans is at risk for not having enough food or enough healthy food every day. We dedicate efforts and resources to increasing access to healthy foods while reducing consumption of unhealthy options like sugary drinks. We advance these changes through increased screening and intervention for nutrition insecurity in clinical care, improved nutrition policy like healthier kids' meals in restaurants, increased participation in nutrition programs such as school and after-school meals, and increased funding for local, community-based entrepreneurs in food deserts. Tobacco continues to kill nearly 500,000 Americans every year. An alarming 1 in 4 high school students nationwide reported using an e-cigarette, and targeted marketing has disproportionately impacted communities of color. We work with communities and schools to prevent youth from starting, support individuals in quitting, and tirelessly advocate for public policies and funding that protects everyone from unhealthy exposure. Heart disease is still the #1 killer of women, and women of color are at a 47% higher risk for stroke. Our initiatives address these risks, helping women take charge of their health. We are focused on closing participation gaps in research, increasing women's representation in science, increasing access to care, and reducing cardiovascular risk across critical life stages, including pregnancy and menopause. And when prevention efforts aren't enough, everyone deserves an immediate life-saving response. Today, where someone lives, their gender, or the color of their skin can greatly diminish their chances of receiving CPR, emergency services, and the quality healthcare needed to survive. We are building a nation of lifesavers, working to end these disparities by ensuring places like schools and businesses require CPR training and emergency response plans that save lives. 911 operators can provide high-quality CPR instructions when somebody calls for help, and hospitals are providing the highest quality of care. It's because of issues such as these that improving the health and well-being of our communities is essential. For ourselves, for our loved ones, for our communities, we have one mission: to be a relentless force for a world of longer, healthier lives. Together, we will continue to make a difference. Join us.